A northern Arizona resident is dead after contracting a rare case of pneumonic plague, an illness that nobody has had in Coconino County since 2007.
12 News journalist Sean Rice spoke with medical experts from across the state who say human-to-human spread is unlikely.
You might see pneumonic plague 0 times or at the most 1 time in your career, even if you work up in Coconino County.
A once-in-a-lifetime diagnosis for one Arizona resident. Health officials say this person died at the Flagstaff Medical Center Thursday on the same day they sought care.
If I were to speculate that this individual had some sort of exposure to an infected animal that already had it in its lungs, and then it was transmitted from an infected animal.
Dave Wagner studies these kinds of infections at Northern Arizona University. He says the plague is often linked to rodents like prairie dogs, whose colonies can have case after case of the plague. They may then pass it on to a house pet or wild animal. That animal is then usually the link to an infection in humans.
You can see the train of transmission being from the prairie dog to the flea to the dog or cat into the house. The flea bites the human gets bubonic plague.
That kind of plague, bubonic, is noticeable on the skin, causing significant swelling, often black in color.
This hits the ground running, and it's really, really quick, really, really severe. It's extremely hard to diagnose.
And though prairie dogs have been dying in recent months in the Flagstaff area, health officials do not believe this human case is related. Frank Lavecchio, medical director at Arizona State University, says pneumonic plague can often be harder to treat. It even may mask itself as a regular pneumonia case when someone enters a hospital seeking care.
The unfortunate thing is, though, if it does make it to your lungs, it's pretty hard to treat. When you have pneumonic plague, the chances of you dying from it are relatively high, unfortunately.
The plague death in Flagstaff is likely not a major cause for concern. That sentiment echoed by all three experts.
I always tell people worry more about putting on your seatbelt than you should worry about plague.